to cater this group of patients, we got involved with the GPs from the practices, and then the community hub for the primary care network in the community matrons, then the health and well-being workers, and also the patients who have mental health issues to liaise with the mental health teams. And also the main part was the housing, so we got involved with the housing team as well.
I think because we've started with the Houses of Multiple Occupancy, so where they live as a starting point, we didn't really know what we'd find exactly. We had an idea, but so we already have a community health team, primary care, various NHS staff involved. But because we were looking more at the social determinants, where they live, how they live, what connections they have, whether they're employed, alcohol, drug addiction, we sort of have liaised and involved other agencies, but they've not necessarily been sat around the table because we're still going through that process of finding out what the underlying issues are and what we need to put in place to sort of help and address the issues.
Quite varied, but it's basically helping people in the community. We do like a holistic approach with people, see what their lifestyle is like, whether or not we can introduce lifestyle changes, and also possibly change of attitude towards things, make a bit of difference in their lives.
We started with trying to think of something a bit outside the box. We didn't want to do a typical project with people who had a certain disease and work specifically on that. So Dr. Augustine Cruz is very keen on working with people with who lived in HMOs, houses of multiple occupancy, because he feels that social care is a really big problem.
It's a very deprived area, and I think it was also based on where the biggest spend is within that neighbourhood, and the issues that are most common.
We discovered it was quite difficult to find out who these people were that lived in these specific houses of multiple occupancy, because nothing was coded onto GP records or hospital records to state what type of house they had. So we did think very briefly about trying a different subject, but as you'll remember, Lauren Cruz was very keen to ensure that we went ahead and worked with this particular group. So we had to do almost a manual search. We were very, very fortunate that Liz Petch, who works for Blackpool Council, managed to get some permission to share addresses with us, but not names of people. And we had to manually go through each of those addresses to see if we had patients there and get the other 3 surgeries involved that were part of Central West.
I think it's brought a lot of people together to work closer than we've ever done before, especially GPs and health and wellbeing workers, finding out a lot more about patients, community services that probably a lot of us weren't aware of, voluntary services that are out there for patients. Within a GP practice, I suppose the neighbourhood, bringing the GP practices together more as they...
For me, it's pride. It's pride that we were asked. Pride that we were asked and pride that we put it together very well. A lot of hard work in our spare time, and it's all been very worthwhile, hopefully, and a good project for working forward.
Well, hopefully it will continue. It's what a health and wellbeing worker does anyway in the community, and it'd be nice to continue this service to help people in the community that need it, that need the support. It's not always about health, it's also about their wellbeing.